Do you have lower back pain? Does it get worse when you're working all day or if you go for a long drive? If you have lower back pain, at first it often starts off just as a nuisance, something that irritates you throughout the day. But as time goes on, when it becomes chronic, oftentimes people stop exercising, stop going to the gym, they stop doing the activities that they love, and very quickly it can start to reduce the quality of your life and it can make you feel a lot older. If that's you, if you're looking around for solutions for self-care for your lower back, you have come to the right place. My name is Lucas, I'm a yoga teacher, and in this video we'll take a look first and foremost at some of the most common problems in your lower back. We'll look at why doctors can very often help but very rarely have a solution long-term to back pain. And number 3, we'll take a look at 3 weird poses that hopefully will give you some relief right now. Quick disclaimer, before we get started, if you just got hit by a car, if you fell off the cliff skiing, if you have a major injury, please call a doctor. I'm a yoga teacher. Everything that I'll be sharing here is for educational purposes based on my experience, but please be smart. Okay, let's take a look at the lower back. So why is our lumbar region, our lower back, such a hot spot for pain? One of the first reasons just has to do with geography, where it's located. Because our lumbar spine is at the base of our spinal column, it takes the most weight, it takes the most load. And the second reason, which a lot of people never really think about, is your lumbar spine is actually very, very mobile. I know some of you are saying, I'm not mobile, I'm stiff. Even if you're stiff, your lumbar spine has a great deal of mobility compared with your thoracic spine upstream and your pelvic girdle down below. So we've got a lot of range of motion combined with a geographically low region. And for that reason, lumbar vertebra 4, 5, and sacral vertebra 1, usually where those vertebrae meet, that's very often where we have a problem. But not all of our problems are structural. Not all of our problems are related to discs. In fact, the number one problem with lower back pain is actually muscular. What do I mean by that? Well, let's take a look. In between your rib cage and your pelvis, there's a whole bunch of space here, and this is filled in by muscles, among other things. On the back side here, you have your quadratus lumborum muscles, which can get strained. Just like you could damage a hamstring, you can damage your QL muscles. Your erector spinae muscles run up either side of the spine. Even your lats could potentially get damaged when you were lifting, when you were carrying something. And muscle strain, just like you know from injuring a hamstring, can be very, very uncomfortable. But here's the good news. If you have a muscle strain as a source of your back pain, your muscles are highly vascularized, lots of blood flow, which means even though a strained muscle in your lower back might feel just as painful as a herniated disc, it's going to heal a lot faster. Okay, the second most common thing that happens in the spine, which almost no one ever talks about, is a ligament injury. What are ligaments? Well, ligaments are bone-to-bone connective tissues, and your spine is covered in ligaments. This spine here, of course, has been stripped away so you can see it visually. But in your body right now, your spine is covered in ligaments on the front and the back side. And just like you can sprain your ankle, you can sprain your spine. Just like a sprained ankle is difficult to heal, a sprained spine is also difficult to heal. Okay, now the third most common injury is the one that everybody goes to straight away, which is a disc injury. And what happens is in your lower back, L4, L5, S1, it's very common for people to have intervertebral disc dehydration or compression or degradation over time. Osteoarthritis, wear and tear of those discs. This can happen from age, from overuse, from lifting heavy weights, and this can potentially be a cause of pain. Now, for some people, it's more acute, and potentially you have some type of bulge where the nucleus pulposus is starting to push out through the annulus fibrosus, these rings of your intervertebral disc, and it can go so far as to become a full herniation, where that nucleus actually pushes out and will often impinge upon a nerve. Now, there are dozens of other conditions that can happen in your lower back as well, including pinched nerves, including osteoarthritis, including osteoporosis, spinal stenosis, facet joint syndrome, and so many others. Okay, so what do we do with all of this information? Well, First and foremost, the more you know about your injury, the better. It'll help you to figure out your own path to healing. It'll help you take control over your health. But if you don't know everything, or what's very common is you might have a combination of things going on, the best approach is a three-pronged approach to healing. Whether you have a muscle strain, whether you have a ligament strain, whether you have an intervertebral disc compression, almost all of us need to move forward with strengthening practices, balancing practices, and flexibility practices. The strengthening exercises are designed to stabilize and support your spine so you move in a way that distributes the weight equally. Our balancing practices are designed to help us balance right, left, front, back, so we move in a way that's, again, more equally distributing the weight throughout our spine. And finally, our flexibility practices help us to move like a functional human rather than just loading our lumbar region. When you think about a happy back, we like to think about a three-legged stool with strength, flexibility, and balance. Okay, all that sounds like a lot of work. Why don't we just go to the doctor? Let's come back to these three common conditions and think about what does happen when you go to the doctor. Let's imagine you have a strain in your quadratus lumborum muscle and you go to the doctor. Well, you could get some painkillers, some strong painkillers, and some muscle relaxants, and that pain will go away pretty quickly. Perfect. Well, no, not really. It doesn't really solve the problem. That's just treating the symptoms. What if we have a ligament strain? Well, if you have a sprained ankle, you could go put an air cast for 6 weeks, and that would really help you to heal. But guess what? There's no air cast for your spine. And so you could go get some medication, some painkillers, but again, that's not going to help with healing. And there's no air cast to wear on your spine. You really have to learn to move and heal at the same time. Okay, well, what about if we have a herniation? Let's imagine a grade 4 herniation where that nucleus has come out. Can't we just go to the doctor and get a surgery and have that disc removed and like a fake disc put in, or have a spinal fusion? Isn't there something they can do surgically? Sure, yeah. But back pain surgery is a major life-changing surgery, and the results are really mixed. For some people it can work. For some people, it actually creates more problems. Very often when there's a spinal fusion or a discectomy, the pain here in this one region might go away, but the pain can often be transferred upstream or downstream as you lose mobility in that area. Now, in all cases, you should work with your doctor. Everyone's individual. You got to figure out what works best for you. But regardless of whether you have surgery or take pills or do everything naturally, you're still going to come back to the same thing. For a happy back, you need strength, you need flexibility, and you need balance. So why not focus on that specifically? Okay, now that we've understand where the problems are, why they happen, how doctors can help, but probably can't fully solve the problem, let's look at 3 weird stretches. Now, please remember that there are no 3 magical stretches that will fix your back problem, just as there's no magical pill or surgery that'll probably fix your back problem either. But these poses should be able to give you some temporary relief. In future videos, we'll look at strength and balancing practices, which can also help you along with your journey. Before we get into these poses, please know that I'm assuming you have back pain. So we will be very, very mild and very gentle in our approach, knowing full well that as the weeks and the months go by, you'll probably want to up the level of intensity and move on to some stronger poses. Okay, let's take a look. The first pose we'll look at is called a standing Psoas lunge. You need a wall. I have this weird mirrored wall, but you can use any wall in your house that you'd like. For this pose and the other 2 poses, I'd like you to work with 1-minute holds and 5 out of 10 intensity. So take a very, very gentle approach. The reason I'm using the wall for this first pose is because I don't want you to tip over and I'd like you to have support. Here's what we'll do. Stand with your feet about as wide as your hips, but your hip pretty close to the wall. Turn your right foot, your front foot out at about a 45-degree angle, and then step back into a deep lunge with your left leg. Now your front foot is turned out. You can rest your knee or your hip into the wall or not. If you don't need the wall, that's okay as well. What we'll be stretching here is our psoas muscle. This is a weird muscle because it originates at your lower back, crosses your pelvis, and then attaches here on the inside of your femur, which means if this muscle's tight, it can put excess strain on your lower back. I'll start my clock, and then I'll show you what we'll do to get a better stretch. Left arm up, 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 up. Ear and arm in one line. I'll reach up. If I can, I'll touch the wall and hold here. I'd like to feel a big, long stretch, but particularly down there in that weird psoas muscle, which should help to relieve pressure on my lower back. Good. Now do the same thing on the other side. Let's take a look at our second posture. This next pose is called a zombie crawl, and our goal is to create a little bit of axial extension, meaning decompressing our spine ever so slightly. Here's how you do it. Lie down on your belly. Your feet are about as wide as your hips. Really important, your toes are tucked under. Extend your arms out in front of you. Now the next step is really important. Start off by lifting your knees up off the ground by kicking back through your heels. Now lift your elbows off the ground. Stretch your fingertips as far forward as you can. Kick back through your heels as far as you can. Put your nose down on the ground. Hit a timer for 1 minute and stretch out your spine. And then release down, put your forehead on your forearms, and take a break. That's the zombie crawl. One more pose. For the next one, you'll need a chair. This final pose we'll do is called an L fold. We'll make our body into an L shape as we fold forward. Here's the situation. If you have lower back pain, very often this motion is what triggers the pain. At the same time, you need to open up the muscles along the backside of your body so that you can move more freely. But let's see if we can do it keeping our spine in a relatively neutral position. To do this next posture, you need a chair like I have, or a countertop, or like a kitchen table will work just fine as well. Let's start off with our feet about as wide as our hips. Bend your knees as much as you need to. Hinge at your hips. Keep your spine long and neutral. Place your hand on that chair, on the countertop or the tabletop that you might have. Drop your head so your ears are between your arms. Hit a timer for 1 minute, and let's hold here, breathing in and out through your nose. Good. Bend your knees more. Slowly roll your way all the way up to a standing position. So that's the L fold position. So we covered the standing Psoas lunge. We did the zombie crawl. And then finally we finished up with this L fold. If you'd like a pose chart, you can find it down in the description down below. If you'd like more science-based yoga videos, please remember to subscribe. And if you have any questions, please let me know in the comments down below. My full teaching schedule is always at yogabody.com. Thanks so much for joining me, and I hope you found that helpful.